All right, here is the relationship. All right? The relationship between ADHD and bipolar is a one-way street. ADHD children carry no elevated risk for bipolar disorder over that of the general population. No longitudinal studies have found that to be the case, my own included, not the Canadian studies, not the New York studies, not the Iowa, not the Swedish, not the Australian. Risk is 2 to 4%, which is the population rate. So if a child starts out ADHD, that's probably what they're going to stay. Bipolar becomes a very remote diagnosis. However, if there is bipolar disorder in the family, the risk goes up 8 times. Now, the real relationship is from bipolar to ADHD. If a child has bipolar disorder already, and it started in childhood, the risk is 80 to 97% that they will have ADHD along with it. And that is why the confusion. People saw that so many bipolar children had ADHD, they made the leap that the opposite had to be true, that ADHD was a big risk for bipolar, and it turned out to be no risk for bipolar disorder, unless the family history of bipolar illness is there. And then the genetic risks for bipolar disorder, obviously, are what mediate that high risk. So bipolar disorder, only if it starts in childhood, carries a very high risk for ADHD along with it, and ADHD is usually the first disorder to start. If the bipolar starts in adolescence, the risk is 40 to 45% that ADHD is with it. If it starts in adulthood, which is the more typical form of bipolar disorder, the risk is only 20 to 25%. So notice it's the early onset bipolar that brings the risk of ADHD with it, not the other way around. Now, if there's bipolar there and it started in childhood, it is one of the worst psychiatric disorders a child can have, barring infantile autism or schizophrenia. Very difficult to manage. It requires multiple medications to try to deal with it. There is obviously an increased risk of not just destructiveness, but violent behavior, particularly in males. There is periodic hospitalization for safety as well as for re-engineering the psychopharmacology, that is, testing the drugs. Many of the drugs used with bipolar disorder have far more serious side effects than the ADHD drugs do, and so children are often hospitalized partly to monitor the side effects as they're titrating them. The bipolar child has a massive increase in risk for suicide and drug abuse as they enter adolescence. So this is not a fun disorder. But it's 2 to 3% roughly of children have the bipolar disorder, and it is severe, and it is usually lifelong, and it often requires polypharmacy and periodic hospitalization. So the news isn't good. But at least we can say ADHD is not a cause of bipolar disorder. Most ADHD children are never at risk for it. But if there's a family genetic link to bipolar, then that young child with ADHD may also carry that link and that risk.